Please proceed.
I'm Dr. Aaron Curiotti. I'm a licensed physician in California, serve as the Chief of Ethics for the Unity Project. I did my medical training at Georgetown, residency training at UC Irvine, where I was professor in the School of Medicine for 15 years. I directed the medical ethics program at UC Irvine. I directed for several years the medical ethics committee at the California Department of State Hospitals. I also served on the Orange County Vaccine Task Force and was deeply involved in COVID policies at the state and local level. AB 2098 will harm patients. It'll stall scientific progress, hamstring our pandemic response, undermine the trust necessary for the doctor-patient relationship, and worsen the physician shortage in California. A physician with a gag order is not a physician you can trust. Patients want to know that if they ask their doctor a question, including a question about COVID, they'll get an honest opinion from the physician, regardless of whether they go seek a second opinion or follow their doctor's advice. The text of AB 2098 makes 3 statements about COVID that are already outdated because science constantly evolves, as CDC Director Rochelle Walensky recently explained. Last week, for example, a study published in the New England Journal of Medicine showed negative vaccine efficacy against the new Omicron variant. Another peer-reviewed study published 2 weeks ago found reduced sperm counts in men after vaccination. Neither of these efficacy or safety findings was available when this bill was drafted, only very recently. Advances in science and medicine occur when doctors and scientists challenge conventional thinking or settled opinion. Good science is always characterized by conjecture and refutation, by deliberation, fierce debate, and always openness to new data. So trying to fixate any consensus as unassailable is going to stifle medical and scientific progress. Frontline physicians challenging conventional thinking played a key role during the pandemic in advancing knowledge of COVID treatment. For example, ventilating patients.
You were at the 3-minute point. I'm going to let you wind your way to the end and not terminate this abruptly.
Okay, I'm happy to give several examples of what I just mentioned, but
don't take advantage of my patience.
If this bill becomes law, doctors will be punished for practicing medicine according to their best judgment. Informed consent, which is the foundation of medical ethics, will be compromised. Forward-thinking physicians will simply leave the state rather than practice under these conditions. And most concerningly, all that will result in harm to our patients. Thank you.
Thank you, sir, and thanks for your cooperation. Any other opposition witnesses in the hearing room?